My name is Gabby. I'm 12 years old. I have 2 sisters, 3 dogs, 2 cats, and a gecko. I love doing gymnastics. It's my favorite sport. Hoping I can become a great gymnast in the future.
My pregnancy was complicated. She came out at 5 pounds, 5 ounces, almost full term. So really, really tiny for a full term baby. But came out and looked fine, looked healthy. But I would say within about a month, she started having feeding trouble. So throwing up a lot and things like that. That kind of alerted us to like, maybe there's something going on.
I used to be very sick a lot. I wasn't like all the other toddlers. I was usually in the hospital like 24/7. It was like my second home. I also choked a lot when I was younger. Like when I was eating, I still like attempted to eat, but I choked a lot. So that was probably the scariest moment for me.
And then a side of her skull was flattened. And they said, okay, she's gonna need skull surgery at 9 months of age. So we prepared for that, but the feeding problems continued. She had chronic diarrhea and vomiting, and we were just so confused. Like, what is wrong with our baby? What is wrong with our child? She's constantly at children's. She'd had a surgery at 9 months, then had a feeding tube put in it just before she was a year old. And then about 15 months of age, between our genetic doctor and our dermatologist, they figured out that it was Rothmund-Thomson syndrome, and the genetic test came back. That was what it was.
Rothmund-Thomson syndrome is a rare recessive genetic disorder caused by mutations in genes such as the RETQL4 gene. Rothmund-Thomson syndrome is often first identified by a skin rash. Other symptoms may include small stature, sparse hair, and gastrointestinal problems. There is also an increased risk of developing cancer, specifically bone cancer or osteosarcoma. Every patient is unique.
Definitely, it was hard because I couldn't do stuff that other kids were doing. I couldn't really run around. I also had a big backpack for my feeding tube because it was connected to the backpack I had to carry around. So it was definitely hard because also like with confidence when I was younger, I didn't really like who I was, but I've definitely grown to know that like this is me and I'm fine with who I am.
Although she does have RTS, Gabby's life isn't defined as some with RTS. We've seen it her whole life, how we think she's falling behind, and she's always proven us wrong along the way. So
she's just like my spunky little sister. She's very positive, even though she's had a rough go.
The things she says you would never expect. She will just like steal the show, steal the moment. Like, she's very like that.
I think looking back at old pictures and videos really made me think about how far she's come. Seeing how strong she really is now. She looks healthy, she's put weight on, she's muscular. We just didn't know that would even be possible for her when she was younger.
I'm still not like normal kids whose bones are super strong. My bones are very strong for an RTS kid, which is amazing. Also, with confidence, sometimes like, you know how I look a little bit different because of my rash. Sometimes I get stared at a lot when I go places, but I decide to not pay any attention to it because it's not worth it.
In 2009, the RTS Foundation was started by the Kimmel family to create awareness around RTS, as well as to support research and education for this rare disorder.
So the Rothmund-Thomson Syndrome Foundation is very important. It's a place for families and patients to connect to other families and patients who have something so rare that oftentimes their own doctors don't even understand.
We get to hear about other people's stories with it and what's happened in their lives. It's also helpful to maybe some families that just gave birth to like a little baby that has RTS. If they're like really scared and they don't know what to do, they can go online and look up like the RTS Foundation and they can contact people and get help.
We will continue to share new information with families, doctors, caregivers, and the community to help people with RTS lead full and fulfilling lives.
we just want her to thrive in whatever she's doing. You know, she's proven that she can. RTS doesn't have to be it doesn't have to be an absolute limitation. You know, you can still thrive. My hope and prayer is that that just continues. She can continue to surprise us and surprise herself.